Let's hear now from the World Health Organization. Margaret Harris, the Ebola spokesperson at the World Health Organization, is joining me now from Geneva. Thank you very much for joining me there. Now, the World Health Organization is admitting that it did not adequately respond to the Ebola outbreak in West Africa. Now, admittedly, the health infrastructures of those three countries worst affected were swamped. What measures needed to have been in place, though, to ensure that it did not come to what it ended up being?
I would not say that we did not adequately respond. What we are saying is we did not respond quickly enough and we did not respond strongly enough early in the outbreak. Now, this was something that all partners agree, had we all got there early with all the resources necessary, this very large number of cases and this very large number of deaths should have been avoided. What I have seen, I've just been to all three countries, is that when all the things were put in place, indeed the cases have gone. I had a very moving experience. I went back to a community that I was working in September and October when things were at their worst, a community called Camasondo in Sierra Leone, and they now have no cases in their community care centre. And I said to the public health officer in charge, what do you think made a difference? And he said, you people, you came to us when things were terrible. You came to us with ideas, you brought people, you helped us to set up our own community centre in the community, and we have now got no cases. And I went to a village which had been overwhelmed, where many people in the same families were dying,
Right.
and we got the same story. So it's wrong to say we failed, but we certainly were too slow, and we are now put in place, that was what the meeting yesterday achieved, we've now put in place the mechanisms to make sure that we will get there, we will be those people that come when needed, right away, not too late.
You've now put in place, though, the mechanisms to ensure that you arrive in time. What sort of mechanisms, though, are we talking about now?
So we've established a new system. We've been given a mandate now to have within the organization an emergency response. So you think, oh, well, you were always meant to be there for an emergency response. But essentially, in the past, WHO's main role was to provide technical advice, to develop technical advice and to advise governments. And this is fine if our advice is good, but if a government or if a group choose not to take it, what do you do next? Now and also if a government says, well, that's fine, but how are you going to help us? Now we have both things. We have the technical advice and we have the people to go in there and be the boots on the ground. So we've gone from being the people who advise the suits to the suits and the boots on the ground who can really come in there and do what's needed.
So you're going to be the boots on the ground, you're going to be more involved on the ground now, but the World Health Organization says it is experiencing some funding issues. How is this likely, though, to impact the operations of the Ebola crisis?
This is a very important issue, and one of the other things that was established yesterday, again, the Director General was given the mandate to say, when you have a crisis like Ebola and you need to have funds, you can move funds into the area that's most needs to be funded. So yes, we still will need a lot more funding to come in the next 6 months, and that's going to be a challenge when the international community say, oh, but you've got hardly any more cases, why are you still crying out for money? But the really, really big work is ahead of us all now. The big work is to make sure those health systems that were weak in the beginning can be built and built a lot back better. Now, one of the good elements, there are a few good dividends from this Ebola crisis, is that there are large numbers of health workers now who've been trained in infection prevention and control, and this was something that really was non-existent in the health systems in the countries affected, and they've now developed strong capabilities for surveillance of infectious diseases.
Right.
There are large numbers of people who can now work in the system and provide fantastic services, but the challenge is to make sure that they're given jobs and that they're given sustainable jobs, and that that really, really good, strong, effective health systems are built back after this crisis, or right now, as we end the Ebola outbreak, we strengthen the health systems.
Well, you're talking about a large number of health workers now being trained to enable them handle certain situations, but health workers have been, you know, victims as well. Large numbers of health workers in all three countries have been victims of the Ebola situation. Is this a cause for concern at all? Is the World Health Organization concerned about that situation?
Of course we are. It's a very, very serious concern. If you're a health worker and you do everything to help others and that actually makes you ill or kills you, this is an appalling situation. And that's what I mentioned before, the infection prevention and control training and support that we and other partners have given is an extremely important component, because if a health worker is well trained and well provided with the necessary equipment to protect himself or herself from infection, then they will not get infected. We have at the moment got a really important meeting going on here in Geneva to look at exactly how every health worker got infected. Now, we find often it was not the case that it was when they were working in the Ebola treatment unit. What might happen is that they're members of a community, and say a woman is miscarrying, and miscarriage is often the first sign of Ebola in a pregnant woman. And so she's called by her neighbors to come and help, and she doesn't have the the PPE, the protective equipment, to put on when she's at home. So she just puts on a pair of gloves and goes and helps, and that's when she got infected. And we found this over and over again. So we have to do a lot more work about how you must protect yourself at all times, and you have to understand that even something as going into the middle of the night to help a pregnant woman in a time of Ebola, you must think that could be a risk.
All right, Margaret Harris, the Ebola spokesperson at the World Health Organization, joining us there from Geneva. Thank you for your insights.